Today we are going to spend a lot of time talking about healthy bones. Before we get into that conversation, I want to back up a little bit and give you some history of bone health. In the 1930s in America, we had an epidemic of rickets. Rickets is when kids do not have enough vitamin D and their bones get soft and are deformed. So they were not able to walk. There was lots of issues with our children. So it was decided that we needed to get vitamin D into our kids, and we started to fortify milk with vitamin D. And the rickets epidemic was cured. We don't have that problem anymore. Well, kids no longer suffer from bone deformities. Now, we added that vitamin D to dairy, to milk products, but it was also thought that adults needed some extra vitamin D, and one company got on board. It was called Schlitz. Anyone ever heard of that one? Yeah. Ooh, and we're about the same age. It was called Sunshine in a Mug. So it's a beer company, and they added vitamin D to their beer. Yeah, do you remember it? Okay, and Sunshine in a Mug is exactly what vitamin D is. It's the sunshine vitamin. Now, vitamin D is essential for lots of functions in our body, not just bone health. A deficiency of vitamin D can cause cardiovascular health. It can cause depression. It can cause diabetes. It can cause your immune system to fail. So it can prevent you from responding to the common cold or the flu in a negative way. Vitamin D is now known to be the culprit in some cancers. So the recommended level of vitamin D is changing. And when you go to the doctor for your annual physical, more than likely they are going to do a vitamin D level for you. And more than likely you are going to be low. You're going to be deficient. And that's because, number one, we live north of the Mason-Dixon. Vitamin D is the sunshine vitamin. Without exposure to sunshine, our body can't make vitamin D. Most of us have developed a fear of aging in relation to the sun, in addition to the exposure to those rays causing cancer. So when we go out, we slather ourselves in some type of sunscreen, and even an SPF of 8 decreases our ability by 98% to make vitamin D. So we're not getting vitamin D from the sun, and then that fortified dairy that has vitamin D in it, we have figured out that fat-free prevents us from having extra calories and extra weight. So we've all gone fat-free. Well, vitamin D is one of those fat-soluble nutrients. We need fat for it to travel in our body, for us to be able to use it. So most of us are getting our vitamin D in our morning bowl of cereal, right? So we have our fat-free cereal, our shredded wheat, fat-free, and we put our fat-free milk on it, and then we add some fat-free blueberries or strawberries. We've had our breakfast, but we're not able to absorb the vitamin D. And then come February, we start to feel a little blue. We start to feel a little tired. We can't get our workout quite the way we do. All these are very benign symptoms of that deficiency, but it can go on to cause more havoc in our body if we continue on this trail of not getting enough of that magical nutrient. So where else is it besides dairy products? There's a small amount in some cereal or in some orange juice that has been fortified, but most of those are also fat-free. There's a little bit of vitamin D in cold water fish, wild caught mackerel, salmon. Some fish has some vitamin D, and it's in egg yolks. But we've also figured out that those egg yolks has the cholesterol and has the extra calories, so we're doing the egg beaters, which are just colored egg whites, which are not giving us the vitamin D. So what can we do to make sure that we're getting enough? Well, number one is, if we're going to have a fat-free breakfast, if we're going to have that fat-free milk, let's add something nutritious with some fat to that meal. So I use a couple of almonds or a couple of walnuts. That's a very healthy fat that I'm adding, and I'm going to be able to absorb the vitamin D in my milk. I'm going to make sure that 2 or 3 days a week I'm having fish for lunch or dinner. If you eat a pack of salmon, one of those little individual packages of salmon like tuna fish comes in, you're getting almost a day's supply of vitamin D. So that's what I'm going to add to my salad instead of a can or a pack of tuna. I'm going to get the vitamin D from the salmon. I'm also going to make sure that every opportunity I'm exposing myself to a little bit of sunshine. So up to 10 minutes is not going to cause damage. So I'm going to make sure that when the sun's out, even if it's 20 degrees, I'm going to be in front of a window and try to get some of that vitamin D. If I'm told to take a supplement, so if the doctor draws my lab work and tells me that my level's low and I'm to take a supplement, I'm not going to take it on an empty stomach. I'm going to make sure that I'm putting that with the biggest meal of the day. If not, then I'm not getting the benefits of that medication. So when I'm making my choices, I'm thinking of how much vitamin D I really need. 3 dairy products a day, and 3 dairy products a day that have been fortified. Well, right now the rules are you only have to fortify milk. If you're eating yogurt or cheese, it doesn't have to have vitamin D in it, and all manufacturers haven't added it. So I'm going to look at my labels and I'm going to purchase the ones that have vitamin D. I'm also going to go to the only naturally occurring produce that has vitamin D. Does anyone know what that one is? There's vitamin D in mushrooms. There's a very small amount in mushrooms when they're grown, but as they're transported, they too absorb that sunlight and can synthesize to vitamin D. They're making vitamin D fortified mushrooms now. So when manufacturers are producing them, they actually have these tanning beds that the mushrooms roll under before they put them in a package and deliver them to us. Now, between the two of us, they cost a lot more when they've had a sun bath. You've seen them. So, I'm just going to buy those regular old mushrooms, but before I use them, I'm going to put them in the window and let them have a little 20-minute sun bath before I saute them, or before I put them in my omelet, or even before I put them in the refrigerator. So when I bring them home from the grocery store, I'm putting them in my sunroom while I put everything else up. Then the mushrooms will be nice and tan and go in my refrigerator. Really, they don't change color, but they absorb that nutrient. So if I do that on a regular basis, I'm going to have enough vitamin D. Now, probably 60 to 70% of the patients that we see in the hospital are on a vitamin D supplement. And a lot of them are being given that supplement to treat or prevent a terrible disease. There's high levels of vitamin D that a lot of oncologists are prescribing for their patients. Well, one thing that happens is they give them the vitamin D and they forget to tell them that they need that fat for it to be absorbed. So when we see the foods that they're eating and they start to take their vitamin D with fat, their levels go really, really high. So if you've been prescribed a vitamin D and you're not taking it with fat and you start taking it with fat, probably 2 or 3 months from now, you need to have your level checked again because we don't want you to have a toxic amount, too much. Symptoms of having too much are decrease in appetite. Symptoms of having too much is some muscle cramps. But lack of appetite and some muscle cramps are the 2 culprits. The other problem with having too much is it can cause you to have too much calcium in your blood. We need vitamin D to absorb that calcium to be able to reap the benefits. So if your vitamin D level goes up, then the calcium that's in the foods that you're choosing is going to go up too. If you're taking calcium and vitamin D, they do need to be taken together. They partner with each other. If you've been told you need calcium and you were not given a vitamin D, you're probably not going to get the benefits of the calcium. So you need to partner that. Now, vitamin D is fat soluble. So if you're overweight or obese, you're probably going to have a lower level because the nutrient is absorbed into your fat cells and will stay there. So a lot of times the doctor will want your level will want you to be on a supplement to be able to reap the benefits of an adequate level. Now, we said that there's definitely some autoimmune issues going on with a low vitamin D, MS, all those autoimmune diseases like lupus, osteoarthritis, and even it's been found that if we have adequate vitamin D as we age, we keep our balance better. It helps with muscle function. Any of you that are very physical, if you're active, I know Scott, you're a runner, do you notice that when there's less sun, that you don't have quite as much energy and that workout doesn't feel quite the same? That is a decrease in vitamin D. And what they found is as we age, we need a little more. So the recommended amount for someone over 50 is about a quarter again that for everyone else. And it helps not only with balance and with muscle function, but with our bone health. So definitely as we age, we want to make sure that we're focused on what our level is, and then it's really better to get in our diet, so including 3 dairies, and those dairies do need to be defortified. Making the choice of the mushrooms when we can and giving them a little dose of sunlight before we prepare them. Including those fish 2 or 3 times a day is going to help tremendously in preventing the ill effects of not getting enough. Now, I want today to be very casual, very informal, so I want to give you just a minute to digest everything that we've talked about and offer a question and answer. Take 5 for some questions. Anyone have questions about calcium, vitamin D, what we need it for, or any ill attributes that might occur, or any questions about nutrition? Yes?
What did you say the normal recommended dose of vitamin D is, if you're taking a supplement?
Well, it depends on what your level is. Generally they start you with 1,000 IU, international units, but it's not uncommon to be on 3,000 or 4,000 international units, depending on what your level was when they checked it. People that have more pigment in their skin, if you have dark hair, dark eyes, you're not going to get the benefits of the sun as someone with fair eyes and blonde hair. So it's really very individualized. But generally they start with 1,000 and move up from there based on what your blood values are. For 60, 70, 80-year-olds, a lot of times they'll be on 5,000 to 10,000 IUs, just because they need that to keep their level where it needs to be. The normal level is about 50 units right now when they check your blood. They treat for less than 18, generally with a daily supplement. It is rare that I see people that's level is where it needs to be. And most of us are walking around with very low vitamin Ds. Yes?
Is that vitamin D versus calcium? Like, which one is better for you for your bones?
Well, we have to have them both. So we need the calcium for strong bones, but without the vitamin D, our body can't use the calcium. So they go hand in hand. That's one thing that occurred, a few years back. We did these bone density scans, and a lot of women were found to have not enough bone density, and so they were started on calcium supplements. Well, we had all this calcium running through our bodies, and we're even developing some kidney stones in relation to it, but we couldn't use it because we didn't have the vitamin D. So you really need them both. Yeah. Yes?
Alternative that the doctor I've been taking is kefir. Have you heard of it?
I do know of kefir. Okay. Vitamin D has been added to most kefir. It's in the dairy aisle. Like you're growing it yourself and fermenting it and making, okay. And that's another really good point. If you're vegan or vegetarian or have Crohn's disease, if you've had gastric bypass surgery, you're probably vitamin D deficient. If you're vegan, you're not probably eating anything that has a face, so that's going to eliminate the dairy, that's going to eliminate the eggs, probably not going to be doing seafood. You're more than likely deficient. Vitamin D is not in breast milk. So, your pediatrician, if you're nursing your children, will probably give your child a vitamin D supplement as they're growing. Our kids, we never want them to have fat-free milk. We want to make sure that they're getting the 2% milk because we want them to absorb the vitamin D. These are all really good questions. Anyone else have a question?
I'm prescribed 50,000 milligrams once a week of vitamin D. Now I'm finding out I'm taking it on an empty stomach.
Mm-hmm. So I would say start taking it with a meal. When people start taking it with fat, they reap the benefits. So it won't be long until someone's on too much.
Right.
Muscle cramp, bone pain, and anorexia, not having no appetite, is the symptoms of having too much vitamin D.
But we know it's not too much yet.
Right. Now, having too little, diabetes, heart disease, Alzheimer's, cancer, seasonal affective disorder, depression, obesity. For a lot of seniors, when they check their levels, and it's new that they've started checking vitamin D.
That's true.
When they check their levels and they start them on supplementation, they feel like walking, they feel like playing bingo and line dancing. It's amazing. All relate to this. Well, if you think about it, a lot of times you're not out as much as you age. So, you're 80 years old and you think you're blue, but yeah, you're blue because you need some of that sunshine in a glass. Yeah. Any other questions? Yes?
That's what I was going to ask you, that when you go to your doctor for a normal blood test to see your cholesterol levels, do they check for that?
That is not part of a regular panel. So if they checked your cholesterol, they didn't necessarily check your vitamin D. They have to order that outside of your glucose and sodium and cholesterol. It's not a chemistry panel. It's a vitamin D panel. So most doctors are doing that. Now, when I say that, not everyone stays up on the newest, best, and brightest knowledge. So it depends on that office. But most doctors are checking vitamin D levels. And if not, you could definitely say, I understand this could be a culprit of mine because I'm living in Pennsylvania and I'd like to have it checked. Yeah.
Is there something about a vitamin K involved?
Well, vitamin K is more blood and clotting, so not necessarily bone health. Yeah. Yes?
I was at the doctor's the other day, and he mentioned about vitamin D, but
D3.
is very good to take to help prevent the flu.
Because a vitamin D deficiency does decrease your immune responses. So he's wanting your vitamin D to be at a normal level, or even, mid-level. Normal is 50 to 100. So, that's a huge range. There's two kinds of vitamin D. There's D2 and there's D3. D3 is the one that we get from the sun, and you can get them both in a supplement. So what he's saying is you need to increase the one that you get from the sun, the D3. And most people that take a supplement take D3. That is the one that our body uses most efficiently. So that's what he was recommending. Yeah, very cool. You have a good doctor, I think. Yeah. Any other questions?
I think there's been a lot of controversy about people giving medications because they've had bone loss.
Anytime that we reach for a pharmaceutical, there's going to be other consequences to that treatment. And I think a lot of times in Western medicine, we want a pill to fix us. And we forget that with that pill comes an array of other potential harmful effects. That's what's happened with a lot of medication to treat bone loss, osteopenia, osteoporosis. With that said, a lot of times when we look how to proactively prevent the disease initially, we find that it's as simple as making sure we include 3 dairy products in our choices, three milks a day, that we take them with something that has fat, that 2 nights a week we're having a fish for dinner instead of roast beef or fried chicken. So when we do those things, we don't have the bone loss initially. So I think a lot of times doctors are getting to the point that they're looking at the person as a whole and doing preventative medicine. Some of the vitamin K is in relation to the blood disorder that occurred when you were taking the medication for the bone loss. So it was a blood issue that came as a result of treating another disease. And I mean, that happens a lot. You know, we take an antibiotic and we get a yeast infection. You know, so I mean, there are consequences to pharmaceuticals, and a lot of times when we're taking those pharmaceuticals or we're being prescribed them, we have to think about the risk and the consequences that are involved. You know, our lifestyle can be our medicine. We have what we need to be very healthy, naturally occurring, and I think knowledge about how to use that is important. It's really easy to fall into a convenient world and to, you know, start out our day with a breakfast bar and end our day with a microwavable meal. And the nutrients that we're getting there is really not giving our body what it needs to run and be as efficient as it possibly can.
So can you regain if you've had bone loss?
You can. The only thing that's not changing is your eyeballs. We're not growing, we're not changing. They are the same. But other aspects of everything in our body, our skeletal system, can change. And you can prevent additional loss. You know, with enough calcium, with enough vitamin D, and strength training exercises. So, you know, there's a lot in your lifestyle that you can do. Did you change your lifestyle at all? Did you start focusing on dietary calcium and vitamin D? Did you join a class to do line dancing or to bear weights? So all those things are very beneficial in preventing additional bone loss. There are benefits to pharmaceuticals. As we age, bone health is something that's really important. And if they feel like your loss is at a point that you need pharmaceuticals, you probably should follow their. But in addition to that, look at the lifestyle choices that you can put in place to prevent additional loss. So then hopefully your next DEXA scan, you've got much improved numbers. Any other questions? So bear with me for an infomercial. On February 12th, we have our new Living Healthy, Living Well class. That first class is a decision class. You don't have to commit, but come and see what we're about and decide at that point if it's right for you. The program runs for 16 weeks. It is not a diet. It's not a formula to follow. It's individualized for you to help you treat any diseases that you would like to treat, or to help you prevent any diseases. It's also a huge knowledge of nutrition, of lifestyles that can help us all age gracefully. That's what we all want. There's also a behavior modification component to what we teach, so we're going to give you some tools for living. You're going to be able to make it through the Super Bowl party without feeling like you have blown the budget and leave beating yourself up because of. We have a lot of people that say, I have never exercised, I have never been fit in my life, who start out with walking and now are winning marathons. We have one member that just went to New York for the first time. He ran and came in 4th place. You know, the before and after there is pretty amazing. So please join us.